This meeting is being recorded and/or transcribed.
Okay, I will now call the November 10th, 2020 Board of Health to order. Just so everyone knows, tonight there will be no official action taken at this meeting tonight. There will be a general update with a set of recommendations and guidelines and potential orders that are going to be contemplated and considered that will be presented by Monica Heltz, our director, and accompanied by our medical director, Dr. Lane. With an anticipation for final approval or ratification of any of those suggestions on Friday. And I believe, Chris, the time of that meeting is, do you know the specific time?
4 o'clock.
4 o'clock on Friday in this location. I will not be taking public comment tonight, but if you do have any comments that you would like to share with this board or our staff, there will be opportunities provided on our website to provide in writing any comments, questions, or statements that you'd like to share with the board and the staff between now and Friday. And those will be offered to every board member so that they can see those and be part of the record moving forward. With that, I'd like to ask Monica Heltz to come forward and share with us a general update of where we find ourselves in our community in regards to COVID-19. Monica?
Thank you, Mayor Fadness, and thank you, board, for coming. And thank you to our residents who are listening in or are present. Let's see. When the Fishers Health Department first developed our community risk rating scale and released them to the community on August 7th, there were no other metrics available. Neither the ISDH nor the CDC, our usual sources of reference, have put out any guidance for how to assess community risk and make recommendations to schools, businesses, and other facilities based on those risks. The Fishers Health Department developed the metrics we've been using by referencing the Harvard Global Health Institute's key metrics for COVID suppression, the CDC activities and initiatives supporting the COVID response, the CDC's considerations for schools, as well as a host of other references and resources, including those being put in place by other communities. The key metrics that we used, particularly our community transmission indicators, have stood the test of this rapidly changing time. After our indicators were released, the ISDH released theirs using the same basic core metrics. Following that, in mid-September, the CDC released their indicators for dynamic school decision making. While our numerical metrics for the 4 risk levels are slightly more conservative and use slightly different calculations than those by the ISDH, they are actually very similar and the CDC and more in line actually with the CDC's recommendations. The CDC has a 5-level structure, particularly for schools, so there are some slight differences there as well, but the levels match fairly closely with those that we developed back in August. For this, we are really proud. And we're not recommending any changes to those core metrics. As with all things 2020, the data and recommendations have been evolving and changing, and so are our recommendations. So that is primarily what we're going to review today. So just as a reminder, this is the risk-based rating scale that we had developed back in August. We are only recommending some slight changes here as far as just some language and a little bit of the more nuanced things. There are no changes to our primary community transmission metrics. The ISDH does a percent positivity rate that assigns a number of points based on a category of 0, 1, 2, or 3, and then does the same for an incidence rate and then averages those. So their county metrics that they use are a little bit different than these you see here. But again, we're both using the percent positivity rate and we're both using a case incidence rate to calculate where we're at. Let's see, basically we're looking at the primary metrics to determine the risk level. The secondary and tertiary, such as our public health capacity and our healthcare system capacity, are more informing the risk level or deciding if the 2 metrics are split. So our hope would be that at some point soonish we can get those other metrics and calculations up on some kind of dashboard for you guys. We're not quite ready with that yet. So this is the day of the week on Tuesdays when I typically go through each of the details of our risk measures and assign a risk category to the community. Our primary metrics that you can see here, I don't know, can I open this? I don't think I can open that. So on our community dashboard that you guys are probably familiar with, we have a curve and a percent positivity. So I'm just going to go through them. Our primary metrics are our percent positivity rate, which we take from our county rate directly from ISDH, from their dashboard every day, because we do not have data on the total number of people tested that are Fishers residents. We do not receive that data. We have no way to get it down to the Fisher specific level. So that is why we use the Hamilton County percent positivity rate. And then our 14-day rolling case incidence rate is very specific to Fishers. So these are all people that live in Fishers that are reported as a positive, and then we average that over a 14-day rolling period to get at our case incidence rate for new cases per day. Today, both of those indicators are in our red or severe risk level category, level 4. Our percent positivity rate is 16.6% of individuals tested, which is much higher than our 10% cutoff for the red category. Incidentally, there's another percent positivity rate that the state uses. They use an all-test rate that also is over 10% right now for Hamilton County, and that just happened today. Our case incidence rate is 36.65. Again, in order to move into our red category, the case incidence rate needs to be more than 25. So we have definitely surpassed that, and it's rising rapidly. I think the other day we had nearly 100 cases reported for one day. I also typically report on our percent positivity rate at our Fishers Health Department testing site because that is something that we know. We know how many people are tested, so we are able to calculate the rate from that site. And that rate today is 6.7%, which is actually in our yellow category. So that's been bouncing a little bit between yellow and orange on those categories. Regardless, our primary metrics, our percent positivity rate for the county and our case incidence rate are both in our red category, indicating that the community is in a severe risk level for transmission. Again, our secondary metrics inform the primary metrics if we're unsure which direction the community may be heading, or if we're needing to tip the scale into one side or another, depending on the primary metrics. So the second category that we look at is our testing availability. Our testing availability right now is decreasing, although we have been rapidly increasing our capacity. So we saw 414 people yesterday through our testing site. 414, that's double what we were seeing a week ago. We are also looking into additional increases in our testing capacity and looking to expand that further with an additional site. We can now accommodate any Hoosier at our testing site, which helps us accommodate people working or going to school in Fishers and those in unincorporated Fishers, so that we're taking care of our school district and others in the community that may be affecting the spread and may need the same access. Currently, our Fishers testing site is now scheduled out 3 days. We also have that separate link for all Hoosiers, and that site currently has same-day testing availability. So we put that metric in yellow today. The Fishers site is scheduled out in the orange category, but the state one is again available same day, and Fishers residents can go through either portal. So they can get an appointment the same day if they go through the state portal. Our testing turnaround time is typically about 1 day for our Fishers Health Department site, although since this weekend it's been running closer to 2 days, so that has also been increasing. The ISDH funded site is currently at about a 3-day turnaround time. So I would put those metrics at green to yellow category. Our cutoff for green is less than 2 days. Our contact tracing capacity has been substantially diminished during this period, particularly in the past 1 to 2 weeks. The ISDH, the Indiana State Department of Health, has recently handed off a large portion of contact tracing to the local health departments, and they have stated that they're overwhelmed. So that makes us doubly overwhelmed. We were already doing contact tracing for all Fishers residents and trying to follow up on those, although we were having limited success with those that were tested in locations other than our testing site. But we nevertheless continue to try to reach all of those individuals. Overall, about 35% of the positives among Fishers residents have come out of our testing site. So we are at least able to have a lot more success, again, with residents who get tested at our testing site, getting traced and picking up those phones. The success rate for conducting an interview of a case is about 56% since the beginning of the pandemic. Regarding tracing in schools, the schools are responsible for in-school contact tracing. We are handling outside of school tracing and all others. We currently have 9 contact tracers and are rapidly training and bringing on more. We are looking for more options, but at this point the efforts are stretched and will make much less of an impact due to the rapid spreading of this virus in the community. Our hospital capacity, as we look at District 5, as far as capacity and new hospitalizations are clearly increasing, and therefore the capacity is decreasing. The percentage of those hospitalizations that are COVID positive are rapidly increasing as well. We're hearing about reductions in services and staffing shortages and diversions in the hospital system. So we are very close to getting into that zone. I would put that category in yellow to orange zone at this point. Although the schools are not part of our community risk rating scale, I do want to mention them. They are seriously stretched. On Friday, the close contacts associated with the more than 20 cases reported exceeded 200 persons. Some of those are staff, and they are getting close to being unable to staff different buildings. I think we have a really good and strong process in place and a lot of strong mitigation measures in the schools. But the community spread has reached the point where it is seriously straining the system. So I just wanted to review what we know about this virus, and I know most of you on this board, you already know this, but I want to go through it. So one of the things we know about the virus is that it is very highly contagious. One of the ways this is measured is with something called an R value or an R rate. Ours is currently over 1, which means that each person will spread it to more than one other person, which is what leads to substantial community spread. So that's where we're at right now, and almost everybody is in that category, including us. To further complicate this, we have these occasions of what you might have heard of as super spreader events, indicating that some situations and/or people are exponentially more likely to spread this virus. There are other diseases that are more contagious than this, most famously measles, but this nevertheless is spreading very, very quickly, and we do not yet have a vaccine, which we do for measles. According to one risk estimator produced by Georgia Tech, a 10-person event in Hamilton County, at the lowest estimate, would have a 25% chance of having someone with COVID present at that event. A 25-person event would have a 51% chance based on our current spread rates. What else do we know? We know that this is deadly. Globally, there have been over 1.2 million deaths, with over 236,000 in the United States, over 4,000 in Indiana, 136 in Hamilton County, and 38 in Fishers. The mortality rate for the United States is currently at 60.3 per 100,000 of the population. Hamilton County is lucky as usual. We are at 40.2. So we're doing a little bit better than the rest of the country on that measure. Given our kind of healthy population, healthy profile as a county, it's not terribly unsurprising. Fishers is right in there, and we can kind of roughly estimate ours just based on, we have 38 deaths in a population of close to 100,000. Let's see, for comparison, the mortality rate for influenza and pneumonia in 2018 was about 3 times less than what the current mortality rate is for COVID. And the mortality rate for cancer was about 3 times higher. Additionally, the risk of dying from COVID for a person 65 years of age or older is 90 to 630 times higher than that for a young adult in the age range of 18 to 29 years old. Conversely, the risk to a school-age child is 16 times lower than that for a young adult. There's some additional things that we don't know about the virus. For example, the morbidity, like how long is this going to be with us? Is this going to be a chronic disease that we're dealing with for a long time? Long-term effects are currently still being studied. CDC actually says very little about it. It has about 1 paragraph on the CDC website. But there are a wealth of journal articles and news reports showing disturbing trends, particularly related to cardiac, neurological, vascular problems, and others long term. There are also a number of very active Facebook groups for survivors with over hundreds of thousands of members. Top risk groups continue to be older adults, men, obese individuals, and other additional risk groups that are constantly being identified. That list has been growing and changing since the beginning of this pandemic, so we have updated our risk groups on our metrics. What do we know about immunity? We know that most people won't get infected within 3 months, but their antibodies do decline. We know that long-term persistence of antibodies following natural infection is unknown, so until an effective vaccine is widely available, we need to keep going with the measures that are in place and be really vigilant about them. We know that vaccines are in development and deployment plans are being made ready, but it will likely take through 2021 to get enough adults vaccinated to loosen up on these measures. Children will not be in that initial round of vaccinations. We did hear some promising news out of Pfizer. Was that this morning or yesterday? I don't even know. That they're getting closer to a vaccine being ready, and it shows good efficacy, but this is one of many trials. And again, we do hope to see vaccines being deployed before the end of the year, but it will not be widely available to the community for quite some time. Mitigation measures work. We know that. This is a picture that's on this slide is of the Swiss cheese model. This is effectively saying that the layering of all of these measures together are what work, not one single thing. So each thing that you layer on, masks, distancing, sanitation and hand washing, avoiding crowds, each of that adds another level of protection. Some of this we know works because we can directly correlate with studies done in places such as schools where the measures were in place versus not in place and how they fared. We are in the long game now, and we need to keep doing these things and keep doing them extremely well. Again, the risk to our community is too great to ease the mitigation measures in the foreseeable future. We're going to need to learn how to live with this thing for a while. That means that masks, distancing, and hand washing are going to be our mainstays. So this is related to spread of the virus. We know that kind of like other viruses like the flu and TB, even though those are in two different categories, COVID's kind of falling into a mix of those as far as how it spreads. And it's spreading very efficiently, most efficiently in small closed spaces, such as homes, small rooms, crowded areas, and indoors. Indoor spaces are much higher risk than outdoor spaces due to ventilation and dispersion of viral particles. Known contact with an active case is the single greatest risk factor. 50% of people who completed their interview questions during our contact tracing during their case investigation reported knowing that they were in contact with an active case. 42% of people completed the interview questions on their exposure location, with an average of 56 people who completed the initial interview. Of those, nearly 50% reported exposure locations that were in a private residential setting. This is consistent with reports from both ISDH as well as Dr. Fauci and others regarding what is being found on a national level. In quite a few of the cases, individuals specifically reported that there were no masks or distancing in place. An analysis of cases in fissures over time and in recent times, such as last 2 weeks and last month and the last week, show no particular focus, location, or area in fissures that is of greater concern than others, except perhaps one long-term care facility that has recently been experiencing a lot of cases. The spread is happening all over fissures. The spread is going up in the surrounding area, in Hamilton County, in Indy, all of Indiana, and the country. We're part of a mobile community in the northeastern Indy region, so it's not surprising that we're all being affected. All ages in this particular increase period are being equally affected. This is supported by both local, state, and national data. What we saw in August was college-age kids, and that is not what we're seeing now. We're seeing all ages. Cases in schools are climbing rapidly and are reaching unsupportable levels, as I mentioned earlier. Just as a totals from last week, HSC schools reported 88 positive cases, resulting in 828 contacts just from HSC schools. Despite this, a rapid data analysis conducted on the cases reported from HSC schools through November 4th resulted in the following. Of 1,378 contacts, which is how many we had through that day, 47 of those contacts later tested positive. Of those, 39 of them were not tied to school activity. So of the 8 that were, there were 2 from athletics, 2 were classmates, 1 was a boyfriend, girlfriend, 1 was a coworker, and a friend and a teacher, potentially to a student. We can't prove that that's how they got it. We're not doing genomic analysis on these cases, but this is a strong indicator that there has been relatively little spread within the schools and that the mitigation measures are working. Like I said, although I would caution any claims that this is a scientific sample or that the data is perfect, it is not. It's a strong indicator that we're keeping our kids relatively safe in school. There were 5 site visits made last week, and that was even more evident. While there are a few areas that could be tightened up to assure the mitigation strategies are as good as possible, the mitigation strategies in place are clearly helping and working to keep the kids and teachers safe while they are in school. This, again, is supported by state and national data. So these are just some thoughts about what we think we know. We think that people have become more comfortable and have let their guard down, and that there's a sense of complacency about the virus, particularly as we've been opening things up over time. We see it around town, we see it in home, we see it in the workplace, we see it in social settings. Many people are, just going about their business as if this was 2019. Most of the spread seems to be happening without mitigation measures, what we think, right? No masks, no distancing, no sanitizing, nothing. You're in the space of your own home, you feel comfortable, you're with your neighbors or your friends or your family that you see often but aren't members of your household, and that is the vast majority of the reports that we're getting on how this is being spread. Many of us have adapted, especially the kids. The kids on the site visits I made in schools, they were great. There were a couple of masks that were below the nose. For the most part, they had those things on. They were doing their best to maintain the principles that we had laid out. People are stressed, but relatively doing well, according to our initial analysis of our wellness survey. And then there are reports nationally that as far as the people that are unwell and highly stressed caregivers are factoring in the highest. So some challenges that we had as we were trying to figure out how to put together some new recommendations and metrics. One is not knowing the long-term effects of this disease. The mortality rate may seem low to some people. It seems high to me, but it may seem low to some people, particularly because it's skewed so heavily to older individuals. But we don't know what the long-term effects are on any age group. So it certainly, I think, is necessary for us to recommend extreme caution until we have a widely available vaccine that has good uptake in the population. We have challenges with how to enforce any kind of recommendations or orders that would be in people's private homes, because this is where the spread is happening. And I don't think anybody wants us banging down their door to try to tell them that they should have fewer people in their home. We have challenges on how to get everybody to move forward together. We're in a divisive political climate right now, and we're trying to figure out how to move all people together in one way forward to get through this, because again, we're in the long game now. The efficacy of the potential vaccines, we obviously have no long-term data. That report from Pfizer was very hopeful, but not quite conclusive, and it's going to be a while before we see what the true efficacy rates are. All of the potential vaccines in development, or at least most of them, will require a booster after about a month, and likely annually or seasonally, similar to what we do with the flu. Again, we're in a long game. And then we have, again, divisive political environment with possible distrust of the health department, the recommendations, the government, vaccines, and everything else under the sun. So as we were developing these metrics and recommendations and orders, we kind of keyed in on 3 goals related to the strategy that we're recommending and for which we're seeking your support. The goals are based on the knowledge that I've just reviewed, and particularly the need for a longer-term strategy. We expect that there will be revisions, tweaks, and other modifications going forward as evidence changes, but we hope that this basic strategy will hold. The strategy is based on a number of sources, including the CDC, a number of sources from CDC, including their implementation of mitigation strategies for communities with local COVID transmission, indicators for dynamic school decision-making. I could go on. There's a lot of references that we're using, and we'll post those resources. We also reviewed the ISDH county guidelines by color, as well as numerous current public health orders and recommendations that are currently in place throughout the country. So our goals of these metrics are to mitigate spread until there's widespread vaccination, which again, we're looking at least a year. Protect the vulnerable individuals most likely to suffer serious effects, and provide some kind of clarity and actionable steps for residents. So when we're looking at our strategy, some key things pop out. We need to be able to stop gatherings with people outside of their household. So if you're having sleepovers or dinner parties or any of that, it's really imperative that those things stop at this point. We want to prioritize education. We know that Fishers is a community centered around our schools and our children, and we want to limit opportunities for groups to gather. We do not in any way think that this is going to eliminate the spread of this disease in the settings or in the community. We are, again, just hoping to keep things down to a dull roar. So the first of the public health orders that we're proposing is a limit on social gatherings. We've laid these out here in what would be potential recommendations when we're in an orange category, as well as in what we're currently at, which is in the red or severe risk category. So we're proposing that we have a public health order to limit to 10 persons maximum if any kind of gathering indoors. And at that gathering, you must maintain mask distancing and sanitizing. We're also proposing that outdoors, those gatherings be limited to 25 people maximum, again, containing all three of those caveats. We're also proposing these additional orders as an adjunct to our mask mandate. We will add a statement to specify that masks must be worn indoors except while eating or drinking. That means even if you're at a restaurant waiting for your food or drink, you still need to wear the mask. Bar patrons must be seated at a table. No standing or bar service will be permitted. Party sizes at restaurants and other venues are limited to 8 people maximum. No more than 2 people may wait in a lobby, such as if you're waiting for a table in a restaurant or something like that. Others must be outside or in their car and wait to be called. Venues with observers of any kind are strictly limited to 1 adult observer per participant. So if you're thinking of some kind of sporting event or something like that, it would be strictly limited attendance. All extracurricular activities within the schools, including outside group space rental, athletics, extracurriculars, clubs, and anything else that's going on there that isn't part of the school day, is to be canceled, with the exception of the before and after care programs. So this is our risk activity assessment metrics. Again, there are some small changes to the risk groups based on updates from CDC and some slight tweaks to the recommendations in the orange and red categories. We had developed some recommendations, rather lengthy recommendations for when you're in an orange category, what additional measures you can take personally. They're a bit too lengthy to fit into that little box, so I've linked them here. And then in the red category, you see it continues to fall with what we're saying here is that there really should not be any gatherings for people, even though we're putting a cap on 10 for the purposes of the public health orders. We also are putting out some additional recommendations, such as we did when we were in our orange category, and those center around, again, avoiding those gatherings, staying home except for essential services such as school, work, healthcare, and groceries, utilizing curbside delivery, carryout services, and home delivery, working from home if at all possible, increasing your sanitation protocols, and then offering hours for at-risk individuals. We come back to the core principles in all of this that we've had since the beginning, which are masks, sanitizing, distancing. These things are really, really important, and we're finding that when we're not doing those things is when we're having massive spread, particularly in the homes right now. So these are our changes to our school mitigation and activity recommendations. This is where the largest amount of change on this matrix can be found. We feel that it is very important for our schools to stay in school if possible. That said, we recognize that this will more than likely result in cases spreading in the schools. So we want them to make sure that they are increasing their mitigation strategies. And we have developed a fairly lengthy list of requirements for the schools, in addition to the public health order to cancel all extracurricular activities and use of their space. So just to briefly go over what those strategies are, they're based on the CDC's indicators and thresholds for schools. There are 5 core requirements for when they're in an orange and a red category. Again, the extracurriculars are canceled in the red category. We will be monitoring them via environmental inspections that we'll be performing on site at the schools. And we've changed the guidelines for quarantining a little bit so that if there's one case in a class, then that entire class will be quarantining. Our previous standard and the guidelines under the CDC and the State Department of Health generally are that if you have 2 cases in a class, then the entire class quarantines. This will actually make it easier by changing this guideline to 1 case quarantines the entire class. This will actually make it easier for the schools to staff their schools. And they are in favor of this. So our ideas for discussion are these.
Thank you, Monica. And Dr. Lane, appreciate you being here. I know you had a busy day, so thank you for being able to make it. And if either one of you wish to answer these, please, by all means. Tonight, the goal was for you guys to simply hear the narrative from our health department and their suggestions. I know this is the first time you're hearing it, and really wanted everyone to have the opportunity to weigh in, ask questions, provide feedback, and then obviously these considerations would be taken up on Friday ultimately. So with that, I guess I'd open up to the board if there are any questions or thoughts or comments for Dr. Lane or Monica at this time. Yep, you're on.
Thanks. It was very grim scenario that you painted there. Let me see if I can put some positive spin on there. I'm going to try to put a positive spin. We started in March when this thing started ramping up, and obviously we saw a lot of deaths between the span of March to whenever. We're seeing more cases now. What is the mortality rate on those people that are testing positive compared to when we were starting in March and April?
I do not know how the mortality rate has changed over time. We could potentially get back to you with that.
Okay, because I'm guessing that, because I get a daily email from my hospital system, and we're, for the past few months, stuck at a 120, we're up to 140, so we had 20 more deaths over the span of 1 month. But we're talking about a death is a death, no matter what. But the daily deaths, if I were to look back at a calendar, I'm assuming the daily deaths are probably less than they were. They're deaths less now than they were in the previous time.
Correct. I mean, that definitely is true. We had, I think, 34 or 35 deaths for a long time since the beginning, and then through most of the summer, and then it's just in the recent couple weeks that we've seen those start to increase again.
Right. The other thing is with regards to social gatherings in the house and the restaurant scenario. So Thanksgiving dinner with 11 people would be a no, but a 12 people at a restaurant would be okay?
No, I mean, we have a table size limit on the restaurants of 8 people at the table.
No, I'm talking about in general. So I can put 20 people in my house as long as they're spaced out?
We're recommending no people at all in your house besides your immediate household.
Oh.
I think the one thing
It's
here,
not in the order.
yeah, Chris,
but-
from a legal perspective, we are regulating or potentially regulating the size of the table, the number of people at the table, the distance of the table at the restaurants. In people's personal homes, we're recommending that you limit the number of people that come to your home.
I just think the message is going to be, I can go to a restaurant where there's 40 people in the restaurant, but I can't have 10 people in my house. You're going to have to sell that to the public. Because it's sort of like, hey, you know, that Thanksgiving, you can only have 10 people. Oh, wait, that restaurant, well, you can have 40 as long as you have people of 8 there and there. So, I mean,
I think if we could ensure that every home would follow the same procedures and guidelines that we have for restaurants, then you could have 20 people in there and probably
you
feel
go.
safe. But I think we all realize that when we get into our own personal spaces around people that are
Yeah.
close friends and family, we're not doing that, and that's showing up in the test results. And I think that is a burden that we have to try to communicate to our public, that they're letting their guards down, and it's human nature to do that, but we're paying a price for it in the public settings and in the things that we cherish most, like schools. Our ability to keep our schools open, our ability to keep commerce open is directly dependent upon our own personal behaviors in the areas where we don't regulate. And I think that is going to be a very big key component of our community's ability to message moving forward.
If I can jump in for just a second about the mortality rates, the other point I want to make is that they are decreasing globally and locally, but, and that's due in large part to what we've learned about how to treat COVID.
yeah, no, that's,
Yeah.
you know,
Is that what you were?
yeah, well, because we, like I had stated last month at our meeting, that we got a better grasp on how to treat this, and we initially in March and April, now I say we, fortunately we were not New York City, but we learned from New York City, let's put it that way. And I've talked to some colleagues out there that were frontline, both ED and the ICU, and confirmed what I know.
Well, hopefully we won't continue learning from New York City because the situation of our hospitals is getting pretty critical right now.
No.
I got an update today just before I came in, and we had 13 deaths last month. We've had twice that in November. So I think your point's well taken, and that I do think the treatment options are much better. But we are seeing hospitalizations and death by day that's starting to approach what we saw this summer. So I do think we need to keep it in perspective. We're sending ventilators to northern Indiana and getting transfers of very sick people to our hospitals. So, you know, I think that we, you know, as Monica said, I think these things will hopefully keep things at a dull roar, but we want to be sensitive to our educational system and our businesses. But we have to, you know, definitely do the 3 things that she mentioned to try and keep things under control.
Other questions from the board?
Yeah, one of the, so you mentioned you talked about getting some of the ISDH data for Hamilton County. I'm curious, have you done any work reaching out to other health departments, whether in the county or in the city or regional area? Because, you know, certainly we can do our best here in Fishers, but you mentioned we are a highly interconnected community, and we can be incredibly vigilant. But if we have neighbors a few miles away not doing that, has any attempts been made to kind of have a coordinated regional effort in terms of some of these issues that we're addressing in Fishers?
Go ahead, Monica.
Yeah, we've had a regional meeting with Dr. Kane and the rest of the surrounding counties from Marion County, where people have shared some successes and challenges. I think the Indiana Association of City and County Health Officials has a meeting set for next week to discuss the same. We've been in discussion with officials in Hamilton County as well, and with the Hamilton County Health Department to see about a coordinated approach just in the county. And I think we've at least agreed on a strategy around the core messaging to stop gatherings in homes.
I have to take a minute here, and there's no time to be bragging, but especially in these days, but I have to say Dr. Lane and Monica their work. And again, I think we find ourselves in a similar situation. You know, when there was no guidelines or matrix, they did the homework and did the hard work and said, we're going to put a matrix in place with the best information we have at the time, and we chose to act rather than not. And since that time, we've done contact tracing when no other local health departments were doing contact tracing. We're testing more residents than anybody else in the state, and we're taking the knowledge and information gathered from that. And I think what you're finding is, yet again, Dr. Lane and Monica are trying to chart a course forward for our community, and hopefully we can help lead the rest of the region, because we do have this information and we do have people like them that are willing to do the hard work to figure out how you plot a course forward where there really is no playbook. And I appreciate the fact they're following the data, and the data is telling them it's our own personal behaviors that are the root cause of so much of this. And there's good news and bad news in that. One, we've identified the problem. I think the hard part is, how are we going to change that personal behavior is going to be the real challenge ahead of us. Other questions for Monica?
Comment, you know, I don't mean to beat you guys up using my Jersey accent. No, you have a tough, this is tough, right? It's not easy. I'm curious, I'm curious if, what did New Jersey and New York City do that we're not doing? Because everyone says we're not wearing masks, but I go out and I see people wearing masks.
They shut everything down for a very extended period of time, and lots of rapid testing, yeah.
So we're kind of there.
We're
now
taking the shortcuts.
we're
Essentially, I mean, Indiana opened up a lot more quickly than New York City did. New York City was overrun, so they had a little more public support for that, right? People saw the trucks in the streets, and they knew people that were directly affected. We haven't
Those
had that
people
here
escaped
yet.
New York. Those
Right.
people escaped New York and came to now teeth.
I think where we're at too, and Dr. Lane or Monica jump in here, we're trying a couple scalpel approaches to try to tamp down the exponential curve we're seeing. But at some point, those scalpel approaches go away, and you really only have kind of blunt instruments left to try to stop the spread. And I think that's where we're at right now is, are there some activities that we can curb, are there behaviors that we can go in and try to stop in anticipation for, if we don't do that, what tools are we really left with at that point to deal with the spread? I mean, that's an honest assessment of what I heard tonight is, here's a set of recommendations that might slow things down, but if we don't get a handle on this, there's an inevitability about where we're headed. Other questions for Dr. Lane or Monica? Anything about the specific orders that anyone has any questions on? I think maybe it would be helpful to recap. And Chris, maybe from the health order that we're contemplating on bringing forward, can you just go through that specifically as to what legally we would be changing or implementing?
Sure. So, kind of in alignment with Monica's presentation, just to recap, right now there would be an additional requirement for any gatherings or social events which are defined, and they're specifically defined as events, assemblies, or convenings outside of a single household or living unit or religious service that brings together multiple people individually or from separate households in a single space, indoors or outdoors, at the same time, in a coordinated fashion where a significant purpose is to interact with each other. So we would be prohibiting social gatherings unless, in an indoor setting, they would be limited to 10 or fewer people, provided that all the social distancing requirements and hand sanitation measures that Monica mentioned would be implemented. And then outdoor social gatherings would be prohibited unless 25 people or fewer, provided social distancing requirements, sanitation measures, face masks, et cetera. We also have a provision that would be for special or seasonal events, and those are not necessarily events where individuals are coming to interact with others outside of the household, but to attend like a single event. So think of a festival, a fair, a 5K, a tournament. There's a single event that's out there, a show. Those are going to be prohibited unless right now those event plans are submitted to the Fishers Health Department for a plan review. Throughout this pandemic, we've had various levels of event plans that have been required of certain groups to submit to the Fishers Health Department. That has largely been predicated by the governor's executive orders to do that on certain capacity limits. So we're hopeful that most folks that would run into these scenarios would be prepared for already submitting specific COVID health mitigation plans for their events. We would then have additional requirements proposed for restaurants, bars, and retail food establishments. And those would be the ones that Monica went over today, which would be that masks would be worn at all times while indoors except while eating or drinking. Patrons or group parties must be at least 6 feet away from people at other tables, and party sizes must be limited to 8 people or less. Table service is going to be required for indoor dining or drink service. So you're going to have no bar top seating to be permitted, no bar service. Tables, though, that are within a bar area may be open for table service only. Customers are going to remain seated and congregations not permitted. No more than 2 persons may wait in the lobby for a table unless social distancing can be accommodated. So we know there's scenarios where there's a lot of lobbying that are being packed in while people are waiting for tables, and we're going to try to mitigate that measure as best as possible. And then all self-service food stations where non-prepackaged items are available are going to be closed. So those are your salad bars, your vendor stands, et cetera. And then the additional requirements that we would place on K through 12 educational institutions would be to cancel the extracurricular activities and school-sponsored activities, including athletics. However, we are going to have a special exemption for before school and after school daycare to continue to be permitted for schools.
And if we could stop there for a second, because I think this is an important note for the community. If Dr. Lane or Monica, if we just want to explain the rationale for the elimination of extracurricular activities for the time being and our priorities around that in terms of why it is we think that that's important.
Well, I think we as a community can agree that our education of our children is important, and it's the single most important thing, and anything that we can do to preserve that in its best format possible is what we're trying to achieve. And all of those other opportunities for interaction do not achieve that. They result in more quarantines, more exposures. Even though we don't have direct evidence piling up in any way that those events are related to massive school outages, so it's not for that reason. It's really that cumulative effect of having those multiple exposure opportunities and wanting to prioritize which ones we're going to be okay with, and that needs to be in-school learning rather than extracurriculars.
Thank you. Sorry, Chris, is there anything else in that order that you would like to review?
That's it.
Great, okay. I guess I would ask, is there any other question? Yeah, go ahead.
Good question. Does your recommendation or order include all businesses other than just restaurants and bars that have a lobby? Let's say that.
Yeah, great question.
That is a good question. I would like to say yes, but I don't know how to parse that out exactly, so I'm going to defer to Chris.
So right now it doesn't, and I think what we're doing is we're relying on the list of recommendations that Monica's put together for mitigated behavior with respect to businesses. And I know the recommendation list also included additional guidance for school corporations and other entities within Fishers as well. So the measures or the orders, the things we want people to take most grasp at are the ones that I just read to you in those public health orders. But then there is a significant list of recommendations that we're wanting the community to follow that aren't necessarily going to make their way in the public order. And I know there's several with respect to businesses that are in there.
I do think you bring up a great point, and I can see where your own personal experiences with your business, your office, that's something we could probably go back and revisit, because if it's good for restaurants to do that, it may be broader application that we could include in the order for Friday. So maybe we go back and research that and see if there's some complications, because I can totally see where you're coming from on that.
Right, yes, we've already discussed that, especially with the holidays coming up. that-
Absolutely. So I think maybe Monica and Dr. Lane, if we could look at even a broader application of that, it would seem to make sense.
Yeah, I would definitely like to see that. I think it just becomes very difficult to parse it out from the language and to like, you can't limit Kroger to 2 people waiting, right? So we'd have to have very clear situations where
You know,
it applied and where it didn't.
perhaps
But
we can
yeah,
just
that's what I was
brainstorm on that.
envisioning.
Other questions, comments for the team?
Yeah, I've just got one comment. You know, it's one thing to have data and aggregate data and analytics, and it's another thing to have data and analytics that are scalable to Fishers. And then it's quite another thing to have the courage and the leadership to take action. So, Indy and Dr. Lane and Monica, thank you for that.
If for those of you that don't know, that's Chief Arusa, who wasn't able to be here today. So thank you, Chief, for those comments. With that, I guess if we have no other questions or comments, I just want to reiterate that tonight we're going to post these documents and they'll be available for consideration or for people to review on our website. And then you can enter your comments, your questions, your concerns, your statements, and those will all be provided to the board. And we will reconvene Friday at 4 o'clock for final consideration. I think it's, as chair of this board, I guess I would take the liberty of saying we are not in a time of inaction. So the idea that this board's going to get back together and that there isn't going to be some formal action taken, I think is probably not likely. So if people have concerns, questions, comments, please share those in the next 48 hours because we do have to continue to move our community forward and plot a course accordingly. And appreciate everyone paying attention today, and we'll continue to message moving forward. So thank you very much, and we'll be back in shortly. Thank you.
This meeting is no longer being recorded or transcribed.